Hi, my name is Jennifer Almontes. I am one of the public health nurses for the City of Lynn. And if you're watching this video, it's probably because you received one of these iHome COVID-19 self-test kits from the city. Today I'm going to show you how to properly use one of these kits. All right, so once you open up your box, this is what you will find. There's 2 tests in each kit. So you're going to find that there's 2 COVID test cards. There's these tubes that are filled with the liquid that's used for the test. And then you have 2 sets of swabs. You are only going to use 1 for your test. Okay, so you've opened up your box. Here's what you're going to find inside. Testing instructions, COVID test cards, the liquid inside of a tube, that's the testing liquid, and swabs. You're going to find 2 of each one of these. There's actually 2 tests in each box, but you're only going to be using 1 for your test. All right, so next we're going to move to collecting the sample. So first thing you're going to do is you're going to open up your swab. It's important that when you open up your swab that you don't contaminate the swab by dirtying it. You're going to take the swab out. And next you're going to insert this swab into your nostril. You're going to do it 5 times in one nostril, your right nostril, 5 times in your other nostril. And after you have collected that, you move on to the next step, which is actually processing your test. Okay, now we're going to process our sample. So first, it's important to note that you don't want to take your swab that you just used and put it on a table or something, because that's one way that you might contaminate your sample. And the other thing is inside of this tube that contains the liquid, there's 2 ways that the cap screws on, or there's 2 different caps. What you're looking for is this bottom cap, the big orange cap. That's where you're going to use the one that you're going to use to process your actual sample. So you're going to, before you open it, you're going to tap it on the table, and that's just to get the liquid to the bottom. And then you're going to open up the big orange cap, and that's where you're going to insert your swab. Once it's in there, you want to start swirling it in there. What you're trying to do is just get whatever sample you got from your nose. You want it to get inside of that liquid, because the liquid is what you're actually going to use to process your test. And even on the instructions, it'll tell you you just kind of take the swab out a little bit and you squeeze the edges just to make sure that whatever sample you got gets inside of that liquid. That's very important. And then once you have done this 15 times, you're going to remove this, you're going to discard of that swab, and you're going to put your cap back on there. All right, so now we're going to add our sample. Our sample is inside of this liquid that's within this tube. We have to get it on our COVID-19 test card. So we're going to open up this test card and see what's inside. So it even says it on the test card itself that you're going to add 3 drops of whatever liquid's in here to the test itself. That's what we're going to do now. So we're going to unscrew this clear colored cap, and we're going to add the 3 drops to our test. 1, 2, and 3. And next, we're going to wait 15 minutes. So next we're going to interpret our results of our home test. It's important to note that there's a little window here that has a C and a T where you're going to be reading your results. The C stands for control and the T stands for test. So if you have just one line here and no line where the T is, it means that your test is negative. Now if you have a test that shows a line on it, that would mean that you have a positive COVID test. It means that you have to isolate and that you should contact your close contacts and notify them that they've been exposed to COVID.